Well, good morning, everybody. I would like to share a quote from Dr. Tudor Joven, the director of the UPMC Stroke Institute, and I quote, "The biggest mistake people make is thinking it won't happen to them. Strokes can happen to anyone at any age." It happened to me. My name is Mark Woods. I've worked at Passman Hospital since 1974. This is my job at the pathology laboratory. When I graduated in '74, it was my job. I've been here ever since for 39 years. I'm a 1970 North Allegheny graduate and lived in this community all my life. Do I have an amazing story, a miracle story to tell you? I've shared this with a lot of people. It's so incredible. The title of my discussion today is Surviving an Ischemic Stroke. It was May 19th, 2011. It was almost 2 years ago to the date that I went to bed that night. I fell asleep on the couch in my living room. I'm a North Allegheny baseball coach who I've coached North Allegheny baseball for 30 years. So it was 7 days after the completion of the season. So I had a lot of things to do at work. And I go to bed, and all of a sudden I wake up in 4 o'clock in the morning because I look at the TV dials. It's 4 o'clock, and I had like a Charlie horse, a cramp in my left leg. It's killing me. I never get cramps. So I went to move my left side, and I couldn't move my left side. I'm thinking, oh my God, don't tell me I did something my left side wrong. I couldn't move it. So I took my right arm, I went down and I pressed on it, and it got the pain out of it. I said, okay, and I got to go to the bathroom. So I started moving my legs. I couldn't move my legs. I go, what is wrong with my legs? Don't tell me I slept on them wrong. Here's a lab guy thinking all this stuff, okay? In perfect health, never seen a doctor in 40 years. Or here I am, typical hospital person, don't see a doctor. I kind of roll off the couch. I almost landed on the coffee table and smashed it. So now I'm trying to get up. I couldn't get off my legs. I'm crawling, pulling myself on the floor to the bottom of the steps. And I grabbed the banister, trying to raise myself up, and I just lost control of my bladder. I couldn't stop. It just urine everywhere. I said, what is wrong with me? So now I proceeded to go up 8 flights of steps, pull myself up, crawl with my elbows to get up. And I got to the first landing, and there was 8 more steps up. My wife comes out of the room. She goes, what's wrong? Are you having a heart attack? I said, no, I have no power in my legs. I said, carry me to a chair. I'm soaking wet, not in urine, but sweat from the crawl. So my 15-year-old son, he comes out of his bedroom. Dad, what's wrong? I said, just carry me to a chair. I'm soaking wet. So they carry me to a chair, sit me down. I said, give me some underwear. I'm soaking. I'm going to change my underwear. So just then my wife goes, I'm calling 911. And I said, no, you're not. Honestly, no, you're not, because I had to go to work. I just figured I had something my legs wrong and my arm wrong. So I lost that battle. Northwest EMS came up. It might have been 15 minutes later. They come up the steps, did some examination. Mr. Woods, you've had a big stroke. We have to get you to a hospital right away. Do you want to go to Passman or do you want to go to Presby? Well, being a Passman person and a lab guy, I know we have a really great stroke program. So I said, send me to Passman. I know we have a good stroke program. And plus, I'm in charge of the laboratory, so get me there. So it was down in a wheelchair in the ambulance. It was pouring down rain. Of course, it rained every day in April and May that year. So it's in the ambulance on to Passman. So I get to Passman. I go to the ED. I'm asking for this doctor, that doctor. Dr. Bill Christen was in charge, the director at that time. Asked for Bill, Kathy Fadgen, who's the current unit director, my friend's ED. Some people came to my side. All of a sudden, there's my mom. God bless you, Mom. She's already said 2 rosaries for you already. Mom's here. Mom, just stand up, because she was beside my side. My wife was there. People from the laboratory were there. And all this was going on. They said, we have to get you for a CT scan. So I'm scared to death. I'm thinking, what is wrong with me? So I go for the CT scan. I come back, and I had no feeling from my waist down and no movement in my left side. Couldn't move. And people from the lab were there. I guess I was slurring my speech. Didn't know that. I was very coherent. Knew exactly what was going on. They were asking me a zillion questions. And all of a sudden, on a big TV screen, this doctor comes on, and they start talking doctor gibberish back and forth. Everybody's asking me questions. And I guess I was beyond the point of TPA, because when I fell asleep at 11, that was the last time I was normal. Then I woke up at 4. So I was beyond the point of medicine. So with all this conversation, I hear the guy on the TV scene, we have to get him to Presby right away. I said, oh, this is not good. This is not good. I had no idea. I thought they were going to carve my head open, like you hear when, And I'm thinking, this is not good. And I know Mom come over, I'm holding her hand, my wife said, I said, Kath, I said, this is not good. So I said, Dr. Kristen, I said, what's going to happen? She goes, you'll be okay. They're going to take good care of you. And so the show began. Just then the medevac people to fly the helicopter. We can't fly the helicopter today. It's raining out. I go, oh, my God. Now what? So then my wife steps in. Oh, I'm going to drive him down there. I'll get them there faster than those ambulance drivers. So meanwhile, I got IVs going and everything. And they're arguing back and forth over my body. And my wife lost the battle. So I was back in the ambulance. The guys were pretty good. Went down to Presby. I just remember going through on a cart with lights going over my head. They get me in a room and they said, we can get you an MRI. So I go for an MRI. And I come back, I'm laying there terrified. Nobody's in this room, the big light over me, and this doctor comes up to me. He goes, hi, I'm Mohammed Javan. I know how to help you. I've done this procedure before. Sometimes it works. I go, what? I'm going to die. I can't talk English. I'm thinking, that's honest to God. No, I didn't know the guy who was talking to me was the director of the Stroke Institute. He's the best neurological interventional radiologist in the world. He was great. So I'm thinking, oh my God, I'm going to die today. And he said, no, honestly, I thought it was over. And I said to him, well, what's the failure rate? Because I thought he said 60%, that generally works. I thought he said 19%. And then my big question was, well, what's the complications? He said, you could have a cerebral hemorrhage. And right there, I swear to you not, I was going to die. In my mind, I was going to die today. And they were going to bury me in this new black suit that I just bought at Macy's 3 days prior to that for my daughter's wedding in Punta Cana, Dominican Republic. She was going to get married a week later. Because I was in the EDs telling everybody, Doc, you got to get me better. I have to walk my daughter down the Sand Beach Owls. I was Punta Cana next week. I kept on saying to everybody. So finally, I got a grip of myself. I figured they're going to bury me in this black suit. That's a miracle, guys. That is a miracle, okay? So I'm laying there, and finally I got a grip of myself, guys, and I went right to his face, because I had movement in my right arm. I said, I trust you. I think you know what you're doing. Go for it, but talk to my wife first. So he leaves the room, not knowing that all the papers were already signed for this so-called procedure. Meanwhile, I'm thinking they're going to carve my head open, and all of a sudden, he leaves the room, and I think, now what? Now, an anesthesiologist comes over. He comes, I'm Dr. So-and-so. I'm here to give you a local. You won't feel a thing during this. I go, what thing? What are they going to do? Oh, did the doctor tell you? They're going to put a catheter up your femoral artery, and they're going to look around your brain. I go, really? So he goes, here, I'm going to give you this local. I couldn't feel a thing from waist down. It was dead. So next thing you know, 3 nurses come around. Hi, Mr. Woods. We're the nurses. We're here to give you a shave and your haircut in your private area. Oh, do you ever get, we're going to cath you for urine output. Were you ever cath before? I said, no, I cath before. I've never been hospitalized before. Really, never been hospitalized before. So they did their thing, got me through that. And meanwhile, he goes back in the room and he pulls a shield down over me. He said, Mark, you're going to be wide awake during this. You want to talk to me, that's fine. That was a key. That was the key, what he said, key. So he starts the procedure. I don't feel a thing. I didn't even know what was in me or what was going on. I kept on saying, Doc, you okay? Doc, everything all right? Doc, you have to get me better I have to walk my daughter down to Punta Cana next week for a wedding. Doc, you kept on asking questions. He didn't respond. Finally, I got a little frustrated, and I was seeing rings around my eyes. I know that. And here's the big question. Being a baseball guy in the community for so many years. Doc, are you a baseball fan? Out of nowhere behind me, Snark goes, you can't talk to him. He's trying to concentrate. I said, he told me to talk to him. So finally, I hear this clicking in my ear, real loud click, like a cricket in my ear. I said, Doc, I hear this clicking in my ear. He didn't say anything. And all of a sudden, he just walks away out of the room. I go, well, where'd he go? Nurse comes up. Mr. Woods, you're a lucky man. Next nurse, Mr. Woods, you know how fortunate you are? Next nurse, Mr. Woods, you are really lucky. I go, what happened? Oh, the doc will be back to explain it to you. He goes back in the room. He goes, Mark, we just pulled 3 clots out of your brain. 2 were soft, 1 more hard. He goes, let me cure. He goes, lay here, put up your right hand, and go like this. So I go like this. I'm okay right here. Now pick up your left arm. Now I couldn't move it. Now I'm here. Now move your fingers. Within a course of every half hour, of here, and touch your nose. One day it was like this. I couldn't believe it, okay? So they put me for every half hour they're going through all these gyrations and move your leg. I was able to lift my leg a little bit, my other leg, slowly but surely. People were coming in the room to see what was going on. Nursing staff was great. They said, you're gonna go to ICU overnight and we're gonna see how you progress. But they never showed me pictures. Like, what is this picture, Mark? Oh, it's a little boy on a chair reaching for cookies. So I was coherent. What's this picture, Mark? Oh, it's a lady washing dishes and the water's running over the sink. So I guess the cognitive things, I knew what was going on. And then as I lay there on the exam table, my body was convulsing. Every 30 to 45 seconds, I was going like this. And I couldn't figure out what that was. I couldn't control it. I said, Doc, I can't stop these movements. He goes, we'll do an EEG tonight, but I think it'll be okay. I know what happened with that. I'll bring that back to you. So I go to ICU that night. The visitation rules were 3 in a room. My room had 30 people with coaches and kids and mothers and my daughter. Oh my God, they called my daughter from Richmond, Virginia, who's going to get married, and my son from Richmond, because they said this is probably going to turn out bad, you better come. So Katie comes in the room, my son Brandon, and I said, oh my God, what do you guys, oh, we heard you, you're doing good. Katie lays in bed with me, and I said, let's practice our wedding dance. So she's got Facebook going, I'm going like this. So I got more movement, I'm able to swallow, no problem, speech pretty good. And there's my mother, my wife, and I see Dr. Jovi ready to come in the room. I said, you know what, when this man comes in the room, I want you to give him a standing ovation. He comes in, everyone's clapping. My mother's there crying, my wife's crying, they're hugging him. I said, this man saved my life. Katie's crying, she's hugging him. He said, your husband's made a miraculous recovery. We've never had a case like this before. This is amazing to us. He goes, I'm so happy he's where he is. Katie goes, Dad, can he go to the wedding? Well, there shouldn't be any problem. We're gonna see if he can walk tomorrow, but we'll see after tomorrow how he progresses. So it was truly amazing. There's so many people crying in that room, including me. I couldn't be more happy because he saved my life. He leaves that night. Everything went, my EEG was normal. The next morning, the nurse comes in. He goes, Mr. Woods, you want to try to walk? Remember, I couldn't walk. All right, we'll try. So slowly, I moved my legs off the bed, and she goes, let's try to get up. So being like 61 now, all cramped up, my legs are stiff. I was just stiff from laying 2 days. She goes, let's take a walk out the hall and walk. So I could have 100 feet, I'm walking slowly. She goes, are you all right? I said, I'm fine. She goes, let's walk back. She goes, do you want to try some steps? Sure. She opens up the exit door. I go up 3 steps because I couldn't get any further because I had IV lines going. She goes, I said, you're amazing. We've never had a patient like this because all the patients who were in the rooms around me were all bad. My friends were coming up and they didn't know what to expect. When they saw these patients going through the halls, they thought I would really be horrible. Here I'm like a normal person. So I go back, she goes, amazing, you are amazing. She goes, we're gonna recommend you for a step-down room tomorrow. So that night, that's Friday, I go to a step-down room and well, I watched the baseball game that night. There's a key to that Pirate game, even though they were losing, still losing. But the next morning, Joven comes up, he goes, you're amazing, you're fine. I think you can go to the wedding, but you know what, no more than 2 glasses of champagne. I said, I'm good, doc. They put me on Pradaxa, which is a new drug, blood pressure medicine. I went from taking no pills a day to 4, okay? But regardless, I needed to take that. They gave me simvastatin, which is a cholesterol reducer. Even a lab guy, my cholesterol was 170 because there was a hard clot. They wanted even further down. So I'm on that blood pressure medicine in a beta block because this was all caused by atrial fib. It runs my family. Thanks, Mom. Atrial fib, a lot of my brothers have it, and that's what caused the clot. So I did go home. My wife drove me home. I had no restrictions. Nobody said you had to go for therapy. It was like 100% seal off. Okay, so sign off, and then I go home, and I go up to Shire Shave because I had to go to the 1971 Pittsburgh Pirate World Series dinner at the Holiday Inn near the airport. I had tickets. So I'm going to the airport. People say, where were you? We had the show today, Robert Morse. Where were you? Because I'm a big baseball memorabilia collector. Oh, I had a major stroke 2 days ago. You're here? I'm telling the story like I'm telling you. They're like amazed. And finally, they sit me at the table with, guess who? Steve Blass. Well, meanwhile, I'm driving a car. I shouldn't have been driving. I'm driving down 65 going to the airport, and I'm leaning this way because my equilibrium was off. My son, Neil, Dad, you're going to hit the barrier. So I'm pulling myself this way. So no one told me these side effects was going on. So I had to be really careful. We get down there. I'm sitting at Steve's table. I said, Steve, I saw you last night from my bed at Presby. He goes, what were you doing at Presby? I said, I had a major stroke 2 days ago. He had a major stroke. And you're here. You used to be one hell of a Pirate fan. I said, I'm a big fan of yours. So I'm telling the whole story. He's telling me about relationships. He knows family, friends had strokes. I don't know anybody's had the outcome I've had. I'm like a walking mirror. I said, I couldn't believe how lucky I am. So Jovan wanted to see me 6 weeks after I had my stroke. So I went to Mercy. I had my appointment with him. And he was all backed up with patients. Patients were coming in walkers, canes. And I think, am I part of this group? Because I'm basically normal. So I'll go back to that picture. But here it is on Saturday after the baseball function. The next morning, Sunday, I'm going to now my baseball banquet for North Allegheny High School. And I walk in, my wife told my son secretly, go with Dad, because you'll watch, keep an eye on him. So I go in there, and I walk in. People say, there's Coach Woods. He's living. And people are hugging me, crying. The rumor was I was in a coma and died. I go, holy God. Well, if there's such, I was the first speaker for the coaches, and I went up and I said, if there's such thing as a power of prayer, and I think Lori and some of the presenters should have the power of prayer on that screen, because my mother had so many prayer chains going for me, and that really was moving. I had a lot of people praying for actually the lab people actually got in offices and were on their knees praying for me. And I'm grateful for that because it worked. And I thanked everybody that day. Now it's Monday, and everybody figured here at the hospital I was going to be off for 12 weeks. Well, since my department, I'm going to do payroll, and it was a payroll Monday, I started looking at 4 o'clock in the morning. My sleeping pattern was all screwed up. I look at the computer, it was so messed up, the payroll. I said, I got to go to work. My wife was so mad. I get it showered, go in, I go down, I start doing the payroll, and about 2 o'clock in the afternoon, I walk up to the administrative offices to drop off my timesheet, and my vice president's walking down with the new acting administrative director, and they see me walking down the hall, and they're like, I saw a ghost. What are you doing here? I said, I do payroll. You see, my vice president goes, you see this? That says boss, and I'm telling you to go home right now. So I said, okay, let me finish up. I'm going home. And our lab was being certified, cap inspected the next day. I knew that. And so I knew I had to be there Tuesday before I left the flight for Punta Cana on Wednesday. So that Monday, I felt like I'm tired. I'm really beat, guys. I go home and not feel, like another day. So I go to my mother's house. My mother goes, we're going to disown you as a family. What you put us through, your wife's going to leave you, I'm going to disown you. I said, Mom, please, please. No, you're crazy for going back to work. You're the cause of your own problems. Right, Mom? You said that. And so I said, if it makes you happy, I'll call off for tomorrow. Never call off in 25 years or so. Hello, Lou, Mark, I know we're getting cap certified tomorrow. If I come in tomorrow, my family's going to leave me. I can't go to the wedding, so I'm not coming in tomorrow. I'll be home tomorrow, packing for Punta Cana. If anything happens, call me. So I go back to the couch. Okay, Mom, you happy? So I sat in the couch. So I actually fell asleep waiting for my son to come home to my mother's. Fell asleep on the couch, woke up, and now I'm coaching Little League Baseball. He's 12 years old. We have a game in Quaker Valley. So I'm down Squiggly, driving down here, and all the coaches knew I had the stroke. They're all helping me out. Meanwhile, I got black and blue marks everywhere from the stroke. And I go to the field, and my assistant coach is hitting fly balls, ground balls at the kids. So I went out to the outfield. I said, hey, Keith, give me the bat. Let me see if I can hit a baseball. No, I'm really good. Because when those people were sitting there, I can take a baseball bat and throw a ball and hit them right between the eyes. That's how good I am. So the first fly, I'm shoving in the ground. I think, oh my God, I can't hit a baseball anymore. The 6-1, boom, perfect. So I had to reteach myself some functional things. So that was Monday. Tuesday we packed. Punta Cana, we go to Punta Cana on Wednesday. Well, I love the beach. We went right to the beach. My daughter here is the greatest. We're at the beach. I'm laying in a lounge chair. Oh, beautiful, 85-degree weather. I'm laying there, and my older son, who's 28, he's catching my baseball. I hear slap, slap. So I said, Bernie, give me the glove. Let me see if I can catch again. So I can literally catch a baseball blindfolded. So me and Neil catching about 4 or 5 tosses. He throws me the ball like this. And you know what? Honestly, I missed the ball. And guess where it hits me? In the femoral artery where I had the stroke. I go, oh my God! I feel like I'm so mad. My daughter comes running, Dad, you all right? I said, no, I couldn't hit here. So I put my trunks up, and it's all black and blue from the procedure. And Dad, you have to get better because we're going to go ATV tomorrow. I go, I'm going nowhere tomorrow except this lounge chair. She wants to get on a motorbike and go to those train rides. Let's forget that. So, long story short, I was able to walk her down the aisle of Punta Cana. There was no other symptoms, nothing happened to this. And that's a picture of Katie and me at the altar. It's truly a miracle. We cried together. In closing, I just want to say one thing real quick, Gene. The 6-week appointment, the intern come and finally said to me, place is packed, Woods. He's just followed me. So I walked down the hall, and he has his back to me. He goes, Woods, just have a seat behind me. So I sat down. He's at the computer. He looked around. He goes, okay, where's the patient? I said, I am the patient. He goes, you're the patient? You gotta be kidding me. He goes, come here, look at these films. He showed me the MRI films before and after. He said those clots were in your brain, the worst part of your brain. The juncture where it goes from the one side to the other side was totally blocked. So when the clots were removed, those gyrations I had on the table, all the blood coming in, that's where I probably could have a cerebral hemorrhage because the blood flow just came immediately back in. So Joe said to me at that appointment, he went through all these tests, you're perfect. He goes, I don't need to see you again. I said, do I need to see a cardiologist? Oh no, they're gonna tell you to stay on Pradaxa, you're fine. He goes, if you feel better, why don't you come and see me in January, and that's it. So case closed, saw him in January, the nurses there. Now I had some minor complications. I was very reactionary. I couldn't process things all the way through. Didn't know that. So if someone said something to me, I could normally talk it over. I'd be very reactionary, yelling at kids, wife, mother-in-law, and everything. That wasn't me. Employees, wasn't good, that idea. And then my driving coordination was a little bit off. One thing was when I was writing my word, any word I was writing or printing, I would never finish the last letter. So Woods, I'd stop the S thinking of what else I had to do. And if I went, so I wouldn't complete words. So when I went back to my appointment, I was telling the doctor that. He said, Mark, you've had these clots in the worst part of your brain possible. People don't survive these things. Give yourself a whole year. You'll be fine. I'm fine. It all came back. I stopped at a red light. And this, like if you go to Perrysville past St. Teresa's, before you go to my Willie's by 3 Degrees, there's that red light. So I'm stopping at a red light here, and this was red. This turned green, I'd go. Or if I go to a red light, Mount Nebo Road, I look right, I look left, go left. So I wasn't processing things right, but it's all back now. I missed 2 days of work, that was it. And I'm really happy that I can share my story with you because it's so incredible. I have a lot of people to thank, and I appreciate you listening to my story. There is hope for survival. Believe me, I've helped a lot of people through this, but I'm a walking miracle, and I'm really lucky to share my story with you. Thank you so much.